Now, the Philippines just reported its first case of Mpox since December. Now, this is all after the World Health Organization last week declared Mpox a global public health emergency. That's its highest form of alert. Angelica Peebles is here with the latest on that particular move in World Health. This is nowhere near what the response was like during the early days of COVID, but it's still very important. What exactly is the context around this particular move by the WHO?
Yeah, so right now, Africa remains the epicenter of this Mpox outbreak. More than 17,000 cases have been reported there and 500 deaths since the start of this year, mainly in the Democratic Republic of the Congo. A new clade, think of it as a variant, is driving this surge, and a lot of the cases are in children, which suggests that it's spreading more easily through casual contact.
This strain potentially is more contagious through casual contact. So it's not airborne, it's spreading through contact. But the question is it spreading more easily through contact? A lot of the cases probably with children in the DRC are household contact, also spread within institutions inside hospitals and healthcare facilities that are overcrowded. But you worry about what would happen if it got into an institutional setting. Would it spread more easily?
The good news is that we already have vaccines, but the challenge, of course, is making them and getting them to where they need to go. And the biggest Mpox vaccine maker, Bavarian Nordic, saying that it can manufacture 2 million doses by the end of this year and 10 million by the end of 2025. The CEO telling me that they're already looking to increase the capacity even more.
Now, this is one of those situations where capacity is always going to be an issue. Is there a projection that this rises to the point where you would need to see a massive ramp up in production, the likes of which we saw in the efforts to mass produce the COVID vaccine?
At this point, it doesn't seem like that's going to be the case. So far, again, everything we're seeing is really concentrated in Africa. Even these cases, there was one in Sweden last week. That was someone who was in Africa. And with the case in the Philippines that you mentioned at the top here, that still hasn't actually been verified that it's part of this latest outbreak. So at this point, it still seems like it's a concentrated problem. But we'll keep an eye and see if it rises to that level of a mass production effort.
All right. Angelica Peebles with the latest on Mpox. Thank you very much for that.